that we need to pass this legislation. Day after day, we're losing young human beings from our communities. We're losing human beings, 5 to 7 people every single day in this state. And I'm still standing here in front of the steps of the State House saying, please pass this so that we can save lives. Please pass this so not one more child has to die. So I don't know what Aubri would say, but she would say, I'm mad as shit. And the time is not now to pass this legislation. The time was yesterday.
Aubri Esters was an incredible person and a tireless advocate for those who use drugs. In the weeks before her passing, she spoke with my staff on the phone at length as we completed the redrafted version of the supervised consumption site legislation that was favorably approved by the Joint Committee on Mental Health, Substance Use, and Recovery. The legislation would pilot supervised consumption sites in the Commonwealth of Massachusetts, and this would give us another tool to save lives as the opioid epidemic continues to ravage communities across the Commonwealth. And this is ever more important in the time of COVID-19 when we have such isolation. It's my hope that when this bill is passed, that we'll pass it in her memory. And so when it is passed, it should be called Aubri's Law.
I can easily remember a time when things like distribution of naloxone were considered bizarre and exotic, and why would you do such a thing? And now we're in an era where that is just so common and saving so many lives. Safe consumption sites are the same. They have excellent evidence for their benefit, for saving lives, for engaging people in treatment if they're interested in treatment, for helping to prevent spread of infectious diseases. We can be leaders in the country if we can pass this legislation. And I think it's incredibly exciting to have this opportunity. Let's not let this chance pass. Let's get it done in this session and fight for the passage of legislation that would allow us to pilot safe consumption sites. Thank you all.
I'm a professional woman. I've been to college. I've raised a wonderful child. I've done just about everything. But I've also undergone tremendous trauma and a lot of abuse in my life. And I don't use that as an excuse to use drugs. I don't need an excuse to use drugs. I use drugs because I enjoy using them on occasion. I've watched a lot of people overdose unnecessarily. I've lost a lot of lives unnecessarily. So please bring it to bear. Give these people an opportunity to do what they have the right and privilege to do. Thank you for listening, and please help each other.
Hi, my name is Lynn Winkus, and I'm from Team Sharing, Massachusetts. I have with me Nancy Tobin, Gary Carter, and Joanne Revicchio. We are all parents of loss. We have all lost one or more children to overdose deaths. So we're here today to tell you, or to let everybody know, that we definitely are in favor of safe consumption sites. We only wonder, had these sites been available when our child were alive, there's a good possibility that they would be alive today. As long as somebody is breathing, there's always a chance for recovery. Please keep that in mind, and let's get going. Let's get these safe consumption sites going, because we desperately, desperately need them. Thank you.
No one has anywhere to go. People are dying in tents because no one checks on them. People are dying because no one gets them in time. A safe injection facility would give people the opportunity to be seen, the opportunity to walk out alive, and to live another day. But to walk through a door where people care about them and want them to live and don't think they deserve to die because they have an addiction, because they've had a hard life, because they struggle. So let's let this pass, and God bless everybody.
People are losing limbs. They have life-altering complications from having to inject behind a dirty dumpster, from having to inject in a dirty bathroom, alone, trying to hide their use, away from providers, away from anyone who could possibly help them if they have a medical issue. At A-Hope, we have a wall, and it is full of the faces of people that we have lost. Taylor, age 23, Robert, age 19, Khadijah, age 22. You know, and there's whole rows of families, of brothers, of sisters who have died of overdose within months of each other. Imagine the pain and anguish of those family members that could have been spared had we done what is right had we had racial equity, health equity, human rights in our minds as we're passing forward legislation, instead of worrying about what is politically expedient at the expense of people who are suffering the most. The time was not now, it was yesterday. We need to get this done.